Okay, I'm going to be doing my speech today about autism. This is my PowerPoint, and then this is my audience. Okay, so what is autism? In today's society, people with disabilities are often judged and misunderstood. One developmental disability that's increasing in cases each year is autism or ASD. Autism spectrum disorder is a developmental disability caused by some kind of brain abnormality. People with ASD have difficulty with social interactions and lack major communication skills. My personal experience with this disorder is as an ABA line therapist. I work with 3 autistic children ranging in ages 4 to 11. While you typically think as a therapist as just sitting in a room and talking through situations with their client, that is the exact opposite of what my job entails. Because these children are so young and this diagnosis is so new to their families, I simply go in their home and work around their everyday lives while incorporating communication skills as well as verbal practices for their child. From having a pool day to shopping in Target, I am there as a teacher and resource for these children. Disabled people are often judged due to lack of knowledge about their diagnosis, including causes and symptoms, the impact it has on families, and the different severities of the disorder. Informing the public in hopes of increasing awareness is incredibly important to these kids and families. First, I will inform you about the symptoms of autism. As you see above, symptoms of ASD are not the most distinct like a cold or flu. They can be noticed by parents or caregivers during the first 3 years of childhood, but typically not during infancy. By the time the child is a toddler, parents notice that they don't like to be held, are not interested in games such as peekaboo or patty cake, and have not begun to form words. In some situations, an autistic toddler will begin to talk but regress or lose all their language skills. Many people think children with autism are completely isolated or live in a world of their own. This myth is absolutely false. In fact, they are smart, fun, engaging kids who just don't quite have the necessary communication and language skills to function properly. While the severity of symptoms vary greatly among each individual, all the people affected with autism have the core symptoms that fall in the regions of social interactions and relationships, as well as verbal and nonverbal communication. Strong indicators include lack of empathy and understanding of other people's feelings such as happiness, sadness, pain, and excitement, and also substantial difficulty developing nonverbal communication skills including eye contact, body language, posture, and facial expressions. Children affected by autism have a delay in learning to speak. From the webpage posting autism symptoms by HealthWise, 40% of them are completely nonverbal, meaning they never talk. Working as a line therapist, I have seen firsthand how much communication lacks in these autistic kids. They have trouble starting and holding a conversation and also repeat certain phrases of a part or song. Parts of a song. This repeating sensation is called echolalia. While these symptoms are common among all children with autism, what is not common is how the family deals with this diagnosis. Working in the homes of these families and being a part of their everyday lives is important for these young children. They feel comfortable in a familiar environment and my trust is gained a lot faster. For the few hours I'm there, every day we play games, swing on the swing set, jump on trampolines, and play Xbox or Wii just like a normal functioning kid would do. Each week I have 2 or 3 goals I incorporate in these activities. They include counting to 10, telling time, adding and subtracting, conversation starters, eye contact when conversing with someone, tying shoes, and many more. The progress I've seen in the children I've worked with is remarkable. One little boy I started working with in April especially. In just 3 months, he has gone from crying and screaming if he wants something to making eye contact and asking politely for what he would like. Despite the amazing rewarding times I experience with each child and their family, there's a tantrum every now and then. I have also seen how this disability impacts each family. Parents play a major role in how well their child will and can be able to function. They now have the responsibility to provide this child with the necessary treatment while balancing the priority with siblings. Some treatments include different kinds of therapy, including family, behavioral, animal-assisted, and speech therapy. Medications can also be prescribed for the ADHD symptoms. For some families, the diagnosis of autism in one of their children is very tough and often denied for quite some time. They try and find some kind of alternative explanation. I have been in a situation before where a grandparent visited the family while I was at their house, and I was introduced as the nanny rather than therapist. While it may seem wrong not to be open about this diagnosis, it is each family's preference to expose their child however they like. Symptoms of autism and how it affects each family is something we can see. Now let's talk about something we can't see. What causes autism? There is no known cause of ASD other than it's caused by abnormalities in brain structure. Brain scans show how distinct the differences are among the configuration of the brain in children with autism versus a non-affected child. Researchers have combined multiple theories linking autism with hereditary, genetics, vaccinations, and other medical conditions. Researchers have also found that in many families there appears to be some sort of specific gene or factor or some sort of pattern that runs in the family, such as autism or another disability. It appears also that some children are more susceptible to autism, but they have not yet identified a single cause. Other research is being conducted to see if problems during pregnancy have contributed to ASD. This includes environmental factors such as exposure to harmful substances and viral infections. From the research posting Autism Causes by the Autism Society, 1 in 42 boys and 1 in 89 girls have autism in the United States. That is a significant difference, with five times as many boys being affected than girls. Organizations such as Autism Speaks fund studies and research to discover more about autism. Autism Speaks is currently funding multiple studies on the medication of rapamycin. In the article, Brain Study finds that evidence of autism involves too many synapses, and the drug rapamycin helps to restore those connections as well as reduce the autism-like behaviors. This study was conducted on mice, and researchers hope to discover more to someday lead to treatment of autism for humans. With all this information about autism, I hope to stop the judgment of people with disabilities and spread awareness about a disability that is commonly misunderstood. In conclusion, autism is a disability that comes in all shapes, sizes, and severities. There are common symptoms among all, but the way it impacts families is not the same. Years and years of research needs to be done before we fully understand this disorder. Hopefully one day there will be a treatment and affected children and families can live healthy, comfortable lives.